This is Rick. He's our representative on the process.
We met him about 20 minutes ago.
Sorry about that. Some of us have to work, you know. But he's going to tell us a little bit about brain health and a new product that we got on the market. Should be pretty interesting. It's supposed to help with a lot of different things, including brain inflammation and anxiety and depression and stuff like that. Seems like a really cool product. So, all ears.
All right, so we're going to talk about brain health, which is a topic that affects everybody as we age. This is your typical declining brain health chart. Asymptomatic just means you're in normal health. Does that not work?
What's that?
Oh, it goes on the wall, but it doesn't go down there.
Turn it toward, point it into the, you shut the doors, so maybe that's it. Oh, you're trying to get the little red dot?
The pointer, yeah.
Oh, the pointer, the pointer works. But when it goes on the screen, you can't see it on the screen, so you might have to use your fingers on the screen.
There it is.
Technology, come on, technology.
So you're asymptomatic is when your brain's healthy, working perfectly, and then as you age, you'll see some subjective cognitive impairment. You'll forget some words here and there, different things like that. Where are my keys? And then as you get into middle age, you'll start seeing some mild cognitive impairment. So you'll forget a little more, and things will become a little unclear. That's when it's important to get some help and have somebody check you out. And then we get into the stages of Alzheimer's. And this is a part of dementia that's affecting more and more people every year.
So what part would I be when I have to go back upstairs to remember what it was I was trying to get when it was going down the stairs?
That would be mild cognitive impairment.
So he's on the borderline, huh?
He's on the borderline. So as you can see, the earlier that you start acting on things like Alzheimer's, the better off you're going to be, because once you get to the point of no return, then it becomes your brain has degenerated to the point where it's not going to come back from that. So you got to see a doctor. You got to get some professional help, and you can also take some botanicals and do some lifestyle things that'll help keep your brain working. Go ahead.
Doctor tell me that I was beginning of elder age.
That's true, a little bit.
He didn't give me anything, just told me that's what, because I was very forgetful. So
I think one of the keys is a healthy diet. That's number one. Another thing is exercise. You guys should always be doing a little exercise multiple times a week, just as simple as just out doing a walk before dinner, whatever, after dinner, whatever you can handle. And then the third thing is taking the proper supplementation to keep your brain healthy. So, patient that can pass a cognitive screening test but often personally notices a drop in their performance. People who worry that this has been shown to be very likely progress further into decline. And then, not mild, at this stage people can get lost driving, and that becomes very dangerous. People are often unconsciously covering up mental deficits, and those around them may not understand the danger. This is the last stage of effectively reversible. So MRI studies reveal major changes only if the studies are done, which is rare. So average MRIs are going to miss this stuff. So Alzheimer's disease, in very rare cases, patients have had singular health problems causing this level of dysfunction in which the cognition could be restored. Hypothyroidism, B12 deficiency, medication reactions, those type of things. But this is where your families are going to get involved, and they're going to start taking this seriously. All right, so screening is a very important part of this process. You want to get an occasional MRI, have an exam done, and then here is your different memory issues. So transients, forgetting facts over time. These are just things on the tip of your tongue you can't quite remember. They regard this as beneficial as it clears out old memories to make space for new ones. Absent-mindedness, this is just when you're not forgetting where things are. People forget where their phone is. Hey, call my phone, keys, that type of stuff. This includes forgetting to do something like an appointment. or Josh just showing up late, that type of stuff. Blocking. So that's the one where you're at, yeah, I got this on the tip of my tongue. It's an inability to retrieve a memory. Usually it takes a few minutes and then you're like, yeah, that's it. And then misattribution, you're remembering something accurately except for some detail like a time or place or a person. So that's when you believe the thought you had was original but came from something else. All right, so here are some of the causes of cognitive decline. Trauma. There's a lot of traumatic brain injuries going on, not just with athletes playing contact sports. This can be an accident. You can have a car accident, you could fall down, any type of trauma to your head. Toxicity. This is a big one. We've got a lot of toxins in the environment, whether through your food, the air you breathe, the water you drink. There's also some infections that can stimulate this, such as herpes, Lyme's, COVID-19. How many of you got a little brain fog from the COVID? A lot of people. Well, you're lucky. You and me. You and me, kid. So, but COVID has been a big one. Physical damage from toxins blocking function. Biotoxins such as mold and mercury. They estimate that about half of the homes in the United States have mold. And mold is a huge cause of this. Mercury. You got to be careful about heavy metals. So inflammation and oxidation, your glucose, insulin, copper, homocysteine levels, activated microglia. So if you don't know what microglia are, these are the cells in your brain that control the growth and vitality of your neurons. Okay, so these are very important cells that live in your brain. And then you've got heavy metals, iron, free radicals. Insulin resistance, that's another one. Vascular damage, so damage to your vascular system. Hormone loss, that happens at middle age with a lot of people. Mitochondrial dysfunction. So you might have some toxins in your cells that are impacting your mitochondria. Mitochondria are the energy source of your cells. They produce energy in your body. So when a lot of people are fatigued and tired all the time, that generally means your mitochondria are having an issue. You have things like chemotherapy, proton pump inhibitors. I cannot stress how harmful proton pump inhibitors are to your body. You're basically shutting off the production of your stomach acid by taking proton pump inhibitors. Prilosec OTC, Zantac, those type of antacids. Okay? And then statin drugs, they deplete your CoQ10. CoQ10 is a major part of nourishing your mitochondria, so you're going to have no energy with that, or very, very minimal. Okay, so as we look at a disease like Alzheimer's, you start seeing these little plaques forming in the brain tissue, and those are going to interfere with the normal function of your neurons. So you've got amyloid plaques, and they will disrupt the function of your neurons and your synapses. And then this is just basic pathology of how Alzheimer's works. So you have the amyloid plaques, you've got these tau proteins, and they will institute neuronal dysfunction. Eventually you'll see neuronal cell death, and that's what leads to the cognitive impairment. So we're going to address this with some of the things we're going to be talking about. So it's more of the same. So Alzheimer's disease medications, they have not been very successful at all up until this point. You have cholinesterase inhibitors. 14% of the people using this drug, it's limited to 6 months to 1 year. Antagonists, these are often used with these cholinesterase inhibitors, actually increases the rate of decline. And then they attempt to get rid of the amyloid plaques, and that doesn't have any effect either. So they're not really making any headway with all these therapies. And then we've had some FDA approvals of some drugs that are pretty controversial. The FDA, why would they approve any harmful drugs? Who knows?
Cha-ching.
Why not?
Yeah, there's no money involved in this at all. So this gives you a nice picture of how the inside of your brain functions. You've got your neurons, which are your cell conductors. They conduct signals, so they're like your firing mechanisms. You have your myelin sheath, which are these guys here. So that's like the protection on an electrical cord. So that's very important to protect the signals being produced from the neurons and sent to the synapses. So the synapses connect the neurons, or the ends of the neurons, and they make sure the signals go back and forth. And then you got your glial cells. These are your structural support, and they're the source of your energy for the brain. Once these glial cells get impacted by chronic inflammation, you have problems. The growth and survival and plasticity of your neurons is regulated by these proteins called neurotrophic factors. Think of these as the fertilizer for your brain. These are things that are going to help the neurons and the dendrites and the synapses all maintain health and liveliness. Okay. This is the big one. Brain-derived neurotrophic factor. We like to call this BDNF for short. This is where a lot of the research has been done on brain health. This is a measurable protein that they can see the levels of. So this is, like I said, this is your fertilizer for your brain. This also has anti-inflammatory properties, positively impacts anxiety and depression. The current theory with a lot of these antidepressant medications, or SSRIs, is that they help increase BDNF. The sad part about those medications is a lot of the clinical studies that were done showed that they didn't work, or they had adverse effects, and those were kind of hidden from the American public, and the FDA went ahead and approved these things anyway. So fantastic. So there's a high risk of suicide with a lot of these SSRIs. Very, very dangerous. Some of them do work though, but that's the general theory. And so BDNF is a vital in repair and regeneration, and that is what they're looking at when it comes to traumatic brain injury and cognitive decline. And there we go. So how can we protect the brain from losing BDNF? Well, we can do it with some herbal therapies. You have Bacopa. That's a nice Ayurvedic herb. It's one of my favorites. That helps prevent the decrease of BDNF as a result of chronic stress and depression. Ginseng. Ginseng is a wonderful herb. That's an adaptogen. It's also a tonic. Protects against stress and helps prevent the loss of BDNF. And then you have Chinese skullcap. This is it helps. So folks that have a little higher glucose level than you would like, pre-diabetics, some diabetics, they can have accelerated cognitive decline, and Chinese skullcap can kind of get right in the middle of that and help prevent that or lessen it. And then ashwagandha. Have you guys tried ashwagandha? This is one of my favorite herbs. I take it multiple times per day. This just helps keep you calm. It's going to help reduce your cortisol levels. But in this particular application, it's helping mediate the BDNF reduction. So it's helping prevent a loss. And then Gotu Kola, which we're going to talk about more. This, they showed some results in Parkinson's models. Okay, so a very nice little herb there. Okay, biotoxic illness. This is the #1 cause of cognitive decline. So chronic inflammatory response syndrome. This is a multi-symptom, multi-system reaction to a biotoxin. So your body's going into alarm mode here. It sees a threat and the immune system's going into hyperdrive here. So a lot of gene therapy or a lot of genetic disposition has a lot to do with this, but it causes an innate immune response, not adaptive. So the body cannot clear the toxins out of here, and this results in dysregulation of a lot of different systems in the body, particularly in the brain. So this causes a chronic inflammation cycle. This is the beginning of what we call a cytokine storm. Okay? So as I was mentioning, we have a lot of homes in the United States with mold. And this is the primary cause of this. So you've got mold, Lyme, ciguatera poisoning, blue-green algae poisoning, red tide poisoning, and a lot more. 12 to 14% of the population already has this chronic inflammatory response, and they don't know it. And it's causing a lot of cognitive impairment in different age groups. 25% of the population has genes that could cause this already, and they have a sensitivity to this. More than 7% of children under age 11 have this. 16% of the adults have this. So we're talking about 53 million people here. And a lot of them don't even realize it. Okay, so water damaged buildings. So the EPA estimates that over 50% of buildings have water damage. And it's not just from hurricanes and floods, it's from leaky pipes. So almost 14% of all water used in the home is attributed to plumbing leaks. Broken water pipes rank second to hurricanes in the number of homes damaged and the amount of insurance claims. So you have two very common symptoms of this: chronic fatigue syndrome and fibromyalgia. These are debilitating for a lot of people, especially fibromyalgia. It's very, very hard to get energy up. And then you have lack of energy production, and that's at the cause, that's the end result of this CIRS. It's impeding mitochondrial function, and it's resulting in cognitive decline and decreased brain function. All right, toxins commonly found in water damaged buildings poison your mitochondria. Your mitochondria cannot make ATP or normal amounts of energy, so you have an ATP reduction. So this blocks all of those different things that are important to the body's normal functioning. Insulin resistance at the receptors. So you have neuronal death happening because the neurons are not getting any energy. They're not getting fed. And then you have a decline. So microclots, and here we go, activating the microglia into a pro-inflammatory state. This is when your brain cells are going into an active mode to deal with all of this inflammation, and it can't stop, okay? And then you have damage from excess cortisol happening. This blocks melatonin production, causing severe insomnia and leading to further inflammation and damage because you're not getting enough sleep, you're not resting your brain. How many of you can get a full 6 to 8 hours a night? There you go, there's one of us. So that's good. You need that. You need that rest and repair. So we're also seeing a depletion of hormones that maintain your brain, testosterone and estrogen. Okay? So how do we deal with this? Well, it's not by taking non-steroidal anti-inflammatories, because those will deteriorate the lining of your stomach if you take them ongoing. So things like aspirin, Tylenol, ibuprofen, those type of things. They're okay once in a blue moon if you have something that's not, you have a little bruise or something like that, but not on a regular basis. Okay. Okay. These are important nutrients, B vitamins. So they're going to help play a role in neuronal development. Okay, that means you're going to help grow more neurons in the brain. Vitamin D is going to help with a lot of different things: brain size, cell proliferation, growth factor signaling. Zinc, we're going to see normal neurogenesis, that means neuron growth. Synaptogenesis, so we're going to see more synaptic activity, and we're going to see regulation of neurotransmitter release. Iron and copper, so we're going to feed the glial and the neural energy metabolism. We're also going to see some synaptogenesis. We're going to see neurotransmitter function, things like dopamine, serotonin, norepinephrine. Okay, those are all key. Iron and copper are important for preventing anemia as well. And then there's some other things like choline, magnesium, omega-3 fatty acids, and different flavonoids. All right. We have a huge dietary gap with omega-3s. How many of you take your fish oils every day? Not a lot, all right. This is one of the most important nutrients that you can consume on a daily basis to keep your brain healthy and improve it. So Dr. Bill can help you get squared away with that. But most people are not getting enough omega-3s in their diet from eating enough fatty fish. I don't like fish either, so.
What if you're allergic to it?
Then you got to get it from a plant source, like flax. But that's tricky because flax seeds will convert ALA to the omega-3s, the EPA and DHA, but it's a long conversion process, and it's harder as you get older. Okay?
Sugar disrupts it.
Yep, that's a big one. All right, so get your omega-3s. This is a significant risk factor. So low DHA. DHA is the main brain omega-3 that you want to get in your system. That's what your brain is primarily comprised of. So when you're low on this, it's going to help increase the risk of things like Alzheimer's. So get your fish oils. Okay? All right. So DHA is the most abundant omega-3 fatty acid in cell membranes and in the brain and nervous system. Okay? It helps the brain grow, reduce neural inflammation. So here was one of the studies that has been done on DHA, 485 people. This is a randomized, double-blind, placebo study. So what that means is they had one group taking the DHA and the other group that was taking a placebo. I always feel bad for those people. 24 weeks, they supplemented with 900 milligrams of DHA per day. That's a pretty good dose. And they saw an improved learning and memory function, and they deemed it beneficial, and it supported cognitive health with aging. So that's a pretty good dose of a study right there. And you have choline. This is very essential. This is a very important neurotransmitter. Helps with memory, mood, muscle control, and other brain and nervous system functions. So you can't get enough choline in your system as well. All right, and then magnesium. Everybody's heard of magnesium, right? Okay, this is very important in your brain. So what you have here, now just to clarify, that should say 400 to 420 milligrams, not 4,200. Okay, that's what the recommended intake for magnesium is with adults, male and female, and you can see the amounts there. There you see the actual. This is based on averages. So 350 milligrams, where we're supposed to be getting 400 to 420. So we have a 50 to 70 milligram gap. Then females, 310 to 320. You guys are getting about 260. So we have a 50 to 60 milligram gap. Magnesium is hugely important in the brain. Helps with nerve transmission, neuromuscular coordination. It also helps protect against, excessive cell death. Low magnesium can affect your nervous system, causing headaches, brain fog, muscle twitches, tremors, cramps, fatigue, muscle weakness, and mood change. Anybody in the room seeing any of that? So up your magnesium intake. The great thing is Standard Process has a magnesium that is specific for the brain and in a dose that's going to help you fill that gap. It's called Easy Mag. All right, and then your flavonoids. These are going to help affect your brain physiology and pathophysiology via several mechanisms. So they increase neurogenesis, they increase cell-to-cell communication, they restrict neural inflammation, they reduce oxidative stress, they reduce those amyloid plaques that we talked about, and they help with neurotrophin production. They help prevent against apoptosis and help your neurons survive. So very important to get some flavonoids in your system as well. All right, and then we have anti-inflammatory herbs that will help with these pathways of inflammation and inhibit them. So you have these two different inflammation pathways that's showing up there. COX-2, everybody's got a little bit of that going on. That's a natural inflammatory pathway. Okay, these are huge antioxidants. We're talking about curcumin here. It increases glutathione. It helps upregulate those antioxidant pathways in your brain. It also, in animal studies, has shown it suppresses those amyloid plaques. Helps chelate your metals as well. Okay. Here's the important part about the curcumin. We talked about an inflammatory loop that's happening. Well, how do we stop that from continuing? You get the curcumin in your system and it flips those microglial cells that we talked about. It changes them from active to resting. So it breaks that cycle and gets those cells back to regenerative and restoring function. And that's what the curcumin does when you get it into the brain. So it's a huge herb. All right, then you got saffron too. Saffron can help. It has the same mechanism as turmeric. Turmeric's been a lot more well studied. It's not just for weight loss, the saffron. So they did 54 Persian-speaking adults, 55 years of age or older, who were living in a community where they were eligible to participate in a 22-week double-blind study of parallel groups of patients with Alzheimer's disease. They took 15 milligrams of saffron twice per day. They were measuring this against donepezil, 5 milligrams, which is a drug they were producing for Alzheimer's disease. And they saw that it had similar effects, but without any of the vomiting which occurred in the prescription drug group. So, all right, we talked about Bacopa a little bit earlier. Bacopa is fantastic. It helps increase BDNF, brain-derived neurotrophic factor. It also repairs damage with Alzheimer's. So yeah, it reduces oxidative damage. It's also anti-inflammatory. And so they saw a significant improvement in the performance of working memory. So that's the memory that you're accessing on a daily basis. So that's a really good one to have. So here was a study. 54 participants, 65 years or older, 18 weeks. They saw a significant improved word memory recall, as well as results on a color test, as well as decreased depression, anxiety, and heart rate, all decreased for the Bacopa group, but not for the poor guys on the placebo. So feel bad for those people. Now we have another herb that has been very well studied worldwide. This is ginkgo biloba. There's actually a really cool ginkgo biloba farm in South Carolina that nobody talks about. They have about 10 million ginkgo trees down there. This increases circulation to every part of your body. But for the brain, it pushes blood into the brain, helps it circulate a lot better, okay? So it protects against plaque, neurotoxicity. It actually is an antioxidant, and it helps mitochondrial neuron protection in the part of the brain for memory, okay? All right, so they again match this up against donepezil, our favorite, a second-generation cholinesterase inhibitor in a randomized controlled trial. Significant improvement was seen, but both treatments, but only ginkgo had no dropouts due to side effects. So it was less expensive than the drug treatment, and the dosage they took was about 120 milligrams to 140 or 240 milligrams. And they recommended taking this more than 3 months. Okay. Generally, 120 milligrams is going to be a good dose on a daily basis for ginkgo biloba.
How much is in the ginkgo biloba?
The ginkgo forte?
Forte, yeah.
It's a good question. It's probably 120 milligrams, I would guess, if I had to spitball. All right. All right, and then you can combine some of these herbs together to get even better results. Ginkgo and ginseng are a natural combo. They gave this one combination to healthy young adults. They saw an improvement in speed and accuracy in their brain, which was really cool. All right, so let's talk about the Easy Mag. This is the magnesium that I was talking about that's going to help you fill that gap between what you're intaking from your diet and what you need for that 50 to 70 milligrams for the guys, 50 to 60 milligrams for the ladies. This is brain magnesium. This crosses your blood-brain barrier. So your blood-brain barrier is a level of cells that protects your brain against toxins coming in. And it will prevent some things from getting in there that it doesn't want. So a lot of the supplements that you take don't get past that, but this one does. Penetrates that blood-brain barrier, gets in there and nourishes the brain. And it's organic. This is basically 2 plants that we grow on our certified organic farm in Wisconsin. Swiss chard and buckwheat. It's also a great source of vitamin K, iron, and it has some potassium in there as well. And then we have Neuroplex. Think of this as a food multivitamin for your brain. This is going to give you guys a lot of nourishment on a daily basis. It'll just feed your brain, help give it the nutrients that it needs to work properly. And then we have your essential fatty acids that we talked about. The O-Prima DHA is a nice concentration of DHA that is good for your brain. And then we talked about the Ginkgo Forte. This gives you that ginkgo biloba that we were talking about. Gets that blood circulation going into the brain. And that's it for that slide deck. Hang on. Let's switch gears here. All right. All right. So now we have a new formula from the folks down in Australia at MediHerb that was started in a response to the amount of people that were suffering from depression coming out of COVID. Okay? You guys remember that? So they saw a huge uptick in people with diagnosed depression. So they wanted to find out not what was causing it, but what was happening in the brain as a result of this. Okay? Because there were so many people who are suffering from this. Oh, that's your brain on drugs and no, I'm just kidding. This signifies chronic neuroinflammation, and this is what your brain is supposed to look like. It's supposed to be colorful and alive and growing and having a party. Okay? So we have a 4-herb ingredient mix. This is specific for curcumin, Boswellia, Gotu Kola, and a Chinese herb called Bupleurum. And there she is. So this features a very unique technology. Both the turmeric and the Boswellia have been combined with this fenugreek complex we call galactomannins. What this allows those 2 herbs, which are very hard for the body to absorb, it allows them to cross into that blood-brain barrier and penetrate it. So, and the Gotu Kola and the Bupleurum also cross that blood-brain barrier. So you have a very bioavailable formula here. These 4 herbs work synergistically to help with antioxidant levels. They help bring down that inflammation that we talked about. And they have doses that were used in the studies. They have been doing 4 years of clinical studies with this product. Okay? So here's how this little process works. It's really cool. So they extract the fiber matrix gel out of the fenugreek, call that galactomannins. They combine it with a turmeric extract, which is the curcuminoids, which is the active part, goes together and forms a little globules of a sticky gelatinous material, which has the curcumin inside there. Once it gets through your stomach, it attaches to the small intestines and gets absorbed through the cells. And that we see this in less than 30 minutes, we see that in the brain. Anybody done an omega-3 test with Dr. Bill? All right. I highly recommend you do this. It'll give you a baseline of where you're at with your omega-3 levels, and then Dr. Bill can work with you on getting your levels up. It's a simple finger prick test. Takes about a week to get your results back, and Dr. Bill can work with you on that. Now you also have this little guy here. This is neurotrophin PMG. Has Dr. Bill ever talked to you guys about protomorphogens? No. Okay. What protomorphogens are? This is a brain extract. So these are the neuropeptides from healthy brain material. When they are introduced into your system, your body will take antibodies off of the brain and it will attack the protomorphogens. So when you do that, it allows your brain tissue to heal more quickly. Okay? So it's actually a really good thing to consider when you're using any of these products, especially the neuroregenics. And then you've got some stress and mood products. If you've never taken Drenamine, that's a fantastic formula just for adrenal function, emotional balance. You can either use the ashwagandha complex or the adrenal complex. Both of those are good. And then if you're low on minerals, the Mintran, that's a good one too. And then you have your turmeric forte, which has the same turmeric that we talked about. And then your Boswellia complex, which has some of the herbs we talked about, like ginger as well. And then your cod liver oil. If you're looking for omega-3s on a daily basis with the added benefit of vitamin A and D, cod liver oil is a good one. So there we go. So any questions?
Where do we start?
You start by talking to Dr. Bill and telling him what you have going on, and then he can test you and see if any of these products will fit with your body chemistry. So that's always the first step.
By the way, it's 60 milligrams per tablet of the ginkgo.
2 tablets per day.
2 of them would be
120. There you go. So there it is. 2 a day. Yeah. Generally with herbal products, I recommend taking them with meals. The standard process formulas are food-based, so you can take those with or without food most of the time. But anytime you're doing herbs, it's good to have your digestive juices flowing. So I hope that was helpful for you guys.
Well, you mentioned a lot about like blood sugar and stuff like that. Why don't you talk about like type 3 diabetes?
So type 3 diabetes is what they're referring to as Alzheimer's disease. Okay, that's what the medical profession is going for now. They've done a lot of research on Alzheimer's disease, and they're thinking that it is another stage of blood sugar dysfunction. So going from type 1, type 2, and then type 3 diabetes, which has impacted the brain in a very severe way. Okay, so that's one thing you can control, is what you eat and drink, how much sugar you're intaking. And Dr. Bill has also got some wonderful formulas that can help with your blood sugar or glucose maintenance as well.
Want to just tell them about berberine while you're there?
Didn't think about berberine, but that's a good one.
Or gymnemia?
Gymnemia, yes. Gymnemia is one of the very cool Ayurvedic herbs that will numb your sugar receptors throughout the body. If you want to do a really cool little trick, just suck on a tablet of Gymnemia for about 30 seconds and then try to eat a piece of chocolate. The chocolate will taste like wax. It literally will kill your sweet receptors on your tongue. So it's not going to be the greatest tasting stuff when you suck on it, but it's a pretty cool little sensation. So Gymnemia is a great herb you can take on a daily basis to help control your sugar cravings in particular. So if you're like me, you really like dark chocolate and dark chocolate, a cup of raisins. So you take a couple of Gymnema and you won't have that craving after you eat.
I'll give everybody a sample of one if they would like.
There you go. There you go.
Usually what we do is we have you suck on them for about a minute because it takes a little bit to get if you suck on a whole one, it takes a little bit to get the coating off. And then it gets real bitter. And then after you swallow it, if you try eating a piece of candy or anything like that, there's no taste to it at all. So I've had a lot of patients who are diabetics, etc., who have utilized the Gymnemia, and it's really made a difference in their sugar cravings. It's completely dropped them.
Yeah.
Gymnemia.
Yeah.
It's like gymnasium. Gymnemia.
Now, is everybody familiar with what we do at Standard Process? As Dr. Bill talked about that a little bit. So, Standard Process was started in 1929 by a guy named Dr. Royal Lee. Ooh, there we go.
Snickers you can try.
Yeah.
So if anybody wants to suck on one of these or break them in half and do that and try some of that candy bar, you're more than welcome to. You want a whole one or you want me to break them in half?
Oh, no, give me a
Whole
whole
one?
So what Dr. Lee's philosophy was, you're coming out of the beginnings of the industrial food age. So there was a lot of food processors that were coming online in the 20s. And so we were noticing a huge drop in nutritional value with a lot of foods. So we started Standard Process as a way to combat that by introducing whole foods and proper nutrition back into people's diets through a product called Catalin, which was our first formula. It's our multivitamin. So we now have an almost 900-acre organic regenerative farm up in Wisconsin, in between Milwaukee and Madison. And that's where we grow 80 to 85% of the things that go into these products. Now the herbal formulas that I was showing you, that comes from a company called MediHerb down in Australia. And they have relationships with herbal growers from around the world. And they do something I've never seen with any other herbal company. When the herbal grower does their harvest, they will air freight that raw material down to Australia so that it's not sitting on a boat for a couple of weeks and losing potency. So these guys are the best in the herbal business down there. And what they do has to pass the very strict standards of the Australian Goods Association, which is way more stringent than the FDA will ever be. So rest assured, you guys are getting the best quality herbal products from MediHerb. And the same thing we're doing with all of our food-based supplements.
Say that out loud. What did you say, Lynn?
It tastes like nothing.
There you go. Proof is in the pudding there. If you are having issues with your glucose levels, this little powder can be a lifesaver for you. This is designed to be done as a meal replacement. You want to do this for breakfast and then again at night. Yeah, see, there's a bitter beer face over here, man.
Oh, I know. I'm very expressive.
So these shakes will actually minimize your glucose spikes, okay? Everybody, when they eat, they have a huge spike in your glucose levels at the first hour. And then you typically have a little drop off. It looks like a roller coaster. Then after about 3 hours, you go into a deficit. And this is the point where you start getting those cravings, okay? So what this little guy does is it levels out that roller coaster so that you don't have those peaks and valleys, so it eliminates the cravings. It's fantastic. I've tasted. Best part, this tastes really good. The chocolate one is delicious. They really did a good job making this healthy but tasty. So, and it's filling. It's got plenty of protein. It's got some good whole foods, but it has a little carbohydrate blend that forces your glucose to be released more steadily into the system. So I highly recommend doing that if you want to get your glucose levels under control. And in the process, you'll probably lose a few pounds because you're not having those cravings and, doing all that snacking. So,
Does that have monk fruit in it to sweeten it?
yeah. It has a little monk fruit and stevia. But it's good stevia because you don't get an aftertaste with it. So what do you think? That gymnema is powerful stuff, isn't it?
It is.
Yeah.
You kind of touched on it a little bit. Can you elaborate a little bit more on how it affects like the anxiety and depression part of Neuroregenex?
Yeah.
With that?
Let me switch to another slide here. Yeah, you gotta talk to your guy, Bill. This is like, how do you have such a short cord in here, man?
That'll be taken care of next time.
No.
All right.
Our tech guy sold his house and lives in a van now.
Okay. All right, I'm gonna back up here. Okay. Just gonna tell you a little bit more about the product, but I want to get into this a little bit. Okay. Okay, so this was an 8-week randomized double-blind placebo-controlled clinical trial with 91 adults with depression. They were also already on antidepressant therapy. So they introduced the Neuroregenex formula alongside their antidepressant medications. Okay? So they didn't want to interrupt what the regular medical doctors were doing with these patients, but they wanted to see what an impact this product had on those patients. So the first group was in a moderate depression state. By day 56, they were down to a mild depressive state. That's how fast this little guy works. And they saw a greater than 50% reduction in their anxiety scores. The second group was suffering from severe depression. It dropped them down to a mild, basically borderline, from day 56. So you can see how drastic the reduction is. Think about how this changed these patients' lives right there. Okay. Side benefits, they had a drop in anxiety and a drop in sleep disturbances, because this is going to help your brain relax. It's going to cool that fire going on in the brain.
Stop.
Correct.
So which product is this?
This is the Neuroregenex.
It's the one with the 4 herbs.
Well, that's this guy here. That guy. Yeah. This is it. This is your loading dose right here. 2 tablets 3 times daily. In a lot of the studies, they were seeing dramatic results after 30 days at that level. So I would say a minimum of 10 days at that dose, but optimally you want to do that for 30 days. And then you can kind of back off to more of a maintenance dose, so 1 to 2 per day. Okay. The thing about these herbs, they're all anti-inflammatory, they're all regenerative. So if you keep using them, it's going to suppress that inflammatory cycle. Once you can get it under control, it's going to keep it down so that you won't have the recurrence of this chronic inflammation. So I'm a huge believer in turmeric. I take it every day. I take Boswellia every day. I take Gotu Kola every day. Probably why my hair is red, or what's left of it. But
Boswellia is frankincense, and if it's good enough for Jesus.
exactly, it's good enough for Jesus. Good enough for you. Okay. So yeah. So, and the best part about this guy was this. It was safe to use with your antidepressants, so you don't have to interrupt. You don't have to come off of them. Obviously, we'd like to see people wean off their antidepressants, but that's completely up to their primary physician. But the reduction in depression scores, the reduction in anxiety, and the improvement in sleep, that's going to be the biggest thing, is if people can just get some freaking sleep. and regenerate their brain and rest and get that regenerative sleep that they're looking for. It's going to help accelerate the healing process on this. So I think we have a product that really is going to help change a lot of people's lives. These are just some of the diseases that have been affected by this. Okay? By reducing neuroinflammation, you're seeing results with all of these different issues. Everything from traumatic brain injury to Alzheimer's, dementia, schizophrenia, autism, bipolar disorder, type 1 and 2 diabetes, PTSD. I think how many vets we could treat with this and they can finally get some help. Chronic pain, long COVID. So this is going to help get rid of that brain fog that's troubling a lot of people. Okay?
Rick, do you know what the dosage was that they used so you said it was 56 days when they went from severe to mild.
Yeah.
Do you know what the dosage was? I mean, did they do the loading dose for a month
Yeah.
and then cut back, or did they stay on it for 2 months?
They did this for that whole time. They kept them at that level for the whole
They
time.
stayed at 2-3 times a day for.
Yeah.
Okay.
Yeah. That's where they saw that dramatic drop. Yeah. So, but
So this is one that you said, so my daughter is on medication she's 15, and I'm blanking on it right now because I need to say it out loud, but she went from Zoloft to, we took her off of it.
Wellbutrin?
Huh?
Was it Wellbutrin?
No, now it's depression and anxiety. And now I'm looking into getting her tested for ADHD because she takes 8 hours to do homework that should take her 2 or 3. Like, she cannot focus.
Right.
And she said, it's like my brain won't turn off. It's just like moves, like
She's-
constantly.
she wired and tired?
And,
Is she tired too?
well, like, yes and no. Like, when she goes to sleep, she sleeps hard.
Okay.
And she used to take melatonin for a number of years, and I took her off of that because I was like, well, maybe that's why you're so foggy in the morning and you're so hard to get up because you've been taking this for so long.
Yep.
But she used to not be able to go to sleep.
Right.
And it was like out of sheer desperation on my part that I was just like, I need you to go to sleep.
Yeah.
And so she's been off the melatonin for quite a while, but like,
Okay.
I mean, it's so hard to get her up in the morning. And you could have 5 alarms going off. You could be standing above her, so I'm like, oh, she's a teenager. But like, I feel like it's all connected.
It is. It is, definitely.
That's my
I grew up that
part
way.
one question. You know, that one, like, going along with that. Now, my mom's got diabetes. She's already on medication for high cholesterol. She doesn't want to go on the diabetic medication because her brother told her it made him so sick.
Yep.
So, like, you know, what can you take that goes along? Can you take some of this stuff alongside with high cholesterol medication? My dad has Alzheimer's.
No,
My
this
dad is
is.
on donepezil and memetine right now. So, like, can you take things alongside with that, or do you recommend just like ditching the mainstream?
Don't ever ditch the mainstream stuff
Okay.
without.
Well, that's part of the question. Like, that's
Yeah.
a big reason why I'm here, and also because, like, 20 years from now, I don't want to be where my mom and dad are.
Right.
So,
I'm just going to show you. Okay. So there's a lot more studies that we didn't show you. They've been doing this for 4 years. This product's been in practice for 2 years in Australia. Right here. They saw increases in those 3. Serotonin, that affects mood. Melatonin affects sleep, and dopamine. That's going to be huge with Parkinson's patients.
and he's
Yeah.
did that too.
But the first thing they noticed when they increased this brain-derived neurotropic factor was improved sleep quality. But everything else came along with it.
Yeah, they tried to do a sleep mask with him, and he sent it back.
Yeah.
He couldn't do it.
Yeah. Yeah, I'm glad you took her off the melatonin because what you're doing is you're just artificially giving her brain a dose. A lot of times what I've seen over the years is people will take melatonin and they'll fall asleep, but then about 3 hours into their sleep cycle, they wake right up. They can't go back to sleep because they have a little pop of melatonin, to put them to sleep, but their body's not producing enough to keep them asleep for that sustained time. And then some people have like bad dreams with it and stuff like that. So it's not the worst thing to do as a temporary thing, but ongoing is probably not the healthiest. But if you introduce this naturally, if you have their brain produce the melatonin, then you're in business, because then that's not artificially doping them up. You're getting their levels naturally occurring. So yeah, this is just a fantastic little product. I want to show you this. Okay, so this was a schizophrenia study, and these guys saw an increase in BDNF in less than 4 weeks with just curcumin. All right. Once again, I feel really bad for the placebo people because they went down. They saw a decrease in BDNF. But, all right. This shows you that the curcumin was penetrating the blood-brain barrier after 30 minutes. So you see elevated levels of curcumin all throughout the brain. This was people with occupational stress. They were doing 500 milligrams 1 to 2 times daily for 30 days with this exact turmeric, and they saw reductions in stress, anxiety, and fatigue. This was an Alzheimer's study, Alzheimer's disease. This was interesting because they did 2 groups. They did one group that was doing the placebo versus the enhanced curcumin group. This other group was doing the curcumin that you can get at your local health food store versus our curcumin. And the results were almost identical. We talked about those amyloid plaques, that went down. Those harmful tau proteins, those went down. BDNF increased. So across the board, we had excellent results for these people.
You want to touch on the difference between the turmeric that's bound with the fenugreek compared to that with the black pepper that we get everywhere else?
Well, black pepper is an enhanced one. This was just talking about standardized curcumin. So this is turmeric that's been standardized for 95% of the curcuminoids, but there's no elevation of its bioavailability. It's just standardized for that amount of curcuminoids. But it's typically takes a long time for that to get into the system and start working. We're talking weeks for that to really get in the system and begin working. But when you add that galactomannan component, it takes it from taking weeks to work for 30 minutes with 1 dose. So you're accelerating the absorption of the product. It's allowing the curcumin to get in there and do what it's supposed to do in a more rapid pace, so you guys can see better results without having to use a ton of curcumin. It actually lowers the amount of curcumin that you have to use. So that's the benefit of this.
And
that's
then
the magic.
A lot of people think that when it's bound with the pepper that it works, but when it's bound with the pepper, the body dumps it in 30 minutes.
Yes.
Whereas with the fenugreek or that's attached to it through the turmeric forte, that stays in your body for over 3 hours.
Yeah. No, it's magical stuff. This is very exciting. We are very excited on the standard process side because Boswellia has never been put into a bioavailable form like this. So we are seeing better results with this by binding it to this galactomannan complex. So there was another trial here. This was an Alzheimer's disease study as well. This was just with Boswellia. So that here again, they saw increased BDNF levels with these guys. And then that's a little chart that just shows you how this works against neuroinflammation. This was a study where they showed the bioavailability of the Boswellia with that fenugreek matrix. And this gives you kind of a step-by-step on what I was talking about earlier. So you get through the stomach, it attaches itself to the mucosal layer of the small intestine, and then it has direct absorption through the lymph and the bloodstream. And then when it makes a circle around the digestive tract and it comes in contact with the liver leaves it alone. It doesn't attach things to it to disrupt its absorption. So it overcomes that liver metabolism. This is probably the biggest hurdle with curcumin. Turmeric is this metabolism of the liver. The liver likes to bind a lot of things to the curcumin as it's going through there, and it prevents the release of the curcuminoids into the system. Prevents the absorption of the curcumin into the bloodstream. And then Bupleurum. So traditionally this herb has been used to get more qi into your liver in the Chinese traditional medicine. But in this application, this has a lot of anti-inflammatory action. This also inhibits that activation of those microglia that we talked about and improved your BDNF receptor signaling. So it's going to help your BDNF work better. And this was a very cool batch of studies. So just with this little herb here, we had 30 studies comparing the action of Bupleurum to antidepressants. And then we had another 25 studies that used the Bupleurum in addition to the antidepressants. So they saw the use of the Bupleurum was superior to just the antidepressant medicines alone for improving depression. And then we had another trial here, 160 participants, newly diagnosed depression. They used that Bupleurum, 1 gram per day, 3 months. They showed a significant increase in both BDNF and the other one, which is nerve growth factor. That's a neurotrophic factor that helps increase your nerves growing. And then they had improvement in depression and anxiety symptoms along the way. So Gotu Kola. This also has anti-inflammatory action. It's antidepressant, helps with wound. This is an amazing herb. It helps. It's anti-infective. It helps with the healing of tissue. Helps with mood, memory, and cognition. It also helps protect the important mitochondria that we talked about. So it puts a protection against that and the neurons. And these are the active constituents that are in the herb. It showed it readily crossed the blood-brain barrier and offered benefits to reduce neural inflammation. So there we go. It's anti-inflammatory, antioxidant, reduces neurotoxins, it helps protect your neurons, it increases your neurotropic factors, and it's neuroregenerative. So all 4 of these herbs together do everything that we want it to do to reverse inflammation. This is the study that we saw before. The best part, no adverse effects with this product. It's perfectly safe and it has some fantastic results. So I think we're going to help change a lot of people's lives with this little guy. So what do you think?
Thank you.
Too much for my little brain.
I see your brain's working overtime because your hair is standing up straight. I'm jealous. I don't have any hair on top of my head.
So if you rub maybe some of these on
I've tried. Doesn't work.
the Boswellia.
Doesn't work. Supposedly if you rub cayenne on top of your noggin, it'll help your hair grow, but it just
You'd be a hothead.
it just stings like the dickens. So
Anybody who didn't get one of these, do you want to take one home and try it at home?
I'll try it.
You want to try some? You trying it?
okay. Oh, this is one caution we always do with herbs. Pregnant women, breastfeeding is not recommended to use these, just because we don't want to interfere with any of that stuff. But safe with children. So you just have to give them a lower dose. That's all, depending on their weight. So there you go.